Hello everyone, I hope I'm audible. If so, then can you please let me know in the comments? So I'm just gonna wait for a few people to join and then I'll continue. Okay, so I'm gonna continue now, if that's fine. So, hi everyone, I'm Jashvina Gandhi. I'm a licensed psychotherapist and counselor at Fitzoh. And Fitzoh is a online platform that it's a holistic health based platform where we focus on mental and physical health both. And I'm really glad to be conducting this session, and I hope that you can get something from this session and understand counseling a little bit better than when you joined today. So, a little bit about myself before I begin. I'm a member of the Psychotherapy and Counselling Federation of Australia, and I've been working in private practice over the past 1 year. I'm currently also liaising with Fitzoh. So, before that, I used to work with adults and teenagers in the capacity of a counselor in Australia. That's also where I've done my master's degree in counseling. Before we begin this session and start talking about the benefits of counseling, I think it's really important to understand what the term counseling even means. There is so much discussion about counseling, but we don't exactly know what it is, and there's a lot of misunderstanding. So let's clear that. What do we mean by the term counseling? In simple words, counseling is the process by which you get together with a professional and identify the areas in your life that you want to work on. And you set goals that are done within the first session itself. Okay. So as you can see, by the definition alone, we can see that counseling is very simple. It's literally just one-on-one interaction with a therapist. And it is not related to mental illness specifically. It's just to identify areas in your life that are problematic and to work on improving them. So it's not about fixing anything specifically. It's literally just working on yourself. And to understand this better, I'll like to give you an example of 3 people. So let's take person A, B, and C. Okay. Person A is someone who's going through a tough time in life, who's probably depressed, just feeling low and not very good. Person B is someone who is extremely happy, is very motivated, excited to start their day, and just, doing well in life. And let's say person C is somebody who's going through a confusing phase, who doesn't know what they want in life, and who's really confused about what they want to do. So, which one of these 3 people would you say actually can benefit from counseling? I think most people would say person A and C because there is some issue that they need to fix in life. But the truth is that all 3 of these people can benefit from counseling. Okay. In terms of person A and C, they can figure out what they want and how they should improve that, and how they can become happier and less confused. But person B can benefit by simply knowing what's working for them and using that to continue to be happy every day, and also to figure out if something goes wrong, which it eventually, of course it does. That's life, right? There's ups and downs, and when the downs come, you can identify what's the issue and then how you can fix that when it happens, and you learn some coping skills in your counseling sessions as you go along. I think that's the best part with Fitzoh's counseling, because it's weekly, and even if you don't need it in the moment, you can use it as an assisting thing. So for when an issue arises in your life and an unpredictable stressful event comes, you're not so worried about whether you will be able to deal with it or not. You have a counselor to back you up when that happens. So counselors really work with you side by side, and it's not so much as a one-sided relationship where it's just somebody like me lecturing you, but it's more like a hand-in-hand relationship. And when we really fail to deal with these stressors that will arise eventually, it leads to these repressed emotions, which we always tend to avoid and put it in the back of our minds. And then it leads to depression and anxiety and things like that. So there are various times when these kind of stressors happen, and these are the times when you can seek counseling every day. So this could be something like maybe you've experienced the death of a loved one, or you're going through some loss, like maybe you've lost your home, you've lost a job, or you're going through a tough relationship, or maybe even having family issues. So relationships don't have to be romantic, maybe there's a friendship or there's a family problem going on, and maybe you're going through a divorce. And there are multiple negative experiences that one can have. And these counseling sessions could teach you the skills and give you the right tools and resources that would help you in coping with your emotional and personal difficulties as and when they arise. Especially, I think, with COVID-19 this past year, we've all been inside our homes and we've been really stuck in literally four walls, right? And it may feel like we have it good, we're taking a break from work or we're working from home, but there's not the same benefits that we had before. So we can't really have the social interaction that we had in the past. We're not seeing our friends. We're not even able to use our same coping mechanisms, like going for a run, or well, earlier at least we weren't able to go to the gym. At least now that's still possible. But with all this going on, I think now is the time when we're really feeling the effects of COVID-19, that the loneliness has now set in, and now there's been a lot of time for us to even start overthinking. So the anxiety, depression is really piling on, and it's seen more and more in people. So I think now is actually a good time for people to see a counselor and see what it's like. Just give it a try. Maybe you will actually take something away from it. And with all this talk about COVID-19, there's been a lot of myths that I've noticed, especially in the media. And I get a lot of questions like, Jashvina, why should I see a counselor? I don't have a mental illness. I'm fine. I don't have depression or anxiety. Or like, well, why should I pay to see a counselor when I can just talk about my problems with my friends or with my family, right? And I think I'm getting a message. Sorry about that. Okay, it's just a comment on here. Okay, so I'd be happy to answer any questions if you guys have, and maybe we'll leave the last 5 minutes of our live session for answering any questions. So if you do have, please feel free to leave them in the comments and I'll read them and I'll answer them towards the end. Okay, so there's been a lot of myths that I've dealt with. Like, there's a lot of confusion, which I'd like to clear by addressing some of these myths. So the number one myth that I have heard so much is that mental health is only related to mental illness. And I think a lot of us believe that, but do you think it's true? No, definitely not, right? With a lot of mental health talk in the media, we hear a lot of celebrities talk about it, and a lot of social media outlets and even normal media outlets talk about it. And while that's great, it's leading to a lot of recognition of mental health, but it's also leading to a bit of misinformation. So no, mental health is not the same as a mental illness, just like physical health is not the same as a physical illness, right? So when we look at physical health, it's a spectrum. Either you're completely healthy, you're going for a run, you're completely fine, or you're feeling a bit low on some days. You're like, no, today my body is hurting, I'm not feeling well, I'm feeling a bit low. And then there is physical sickness, and you're going through a disease, like you've actually fallen sick, or maybe you're going through a long-term illness like cancer, right? So it's the same with mental health. Mental health is definitely a spectrum. On one end, you're mentally healthy, like, we were talking about person B, who's completely motivated, who's happy. And then there is a middle part, or, a phase where you're just feeling low, you're just feeling like not talking to anybody, just down, overthinking, that kind of thing. And then there is where you're actually facing a mental illness, where it may be long-term, like some depressive disorders, or schizophrenia, or it could be even something acute like anything that happens. There could be trauma in your life, or it could be, paranoia or bipolar disorder, borderline personality. Mental illness is very complicated, so we won't go into that. And there is definitely clinical counseling that you need for that. But for our purposes with Fitzoh, we're going to stick to the first two parts, which is when you're completely fine or when you're completely almost like getting into the low zone, and also for when you're actually facing chronic problems and trauma. So, you don't have to get counseling only if you have mental illness. That's a big myth. You can get it even when you're not completely ill. Okay. In fact, that is when you should get counseling, when you haven't reached that stage, because preventative counseling is always better than when you get it when you're at that stage where it's no longer as useful or needs more work actually. So we see physicians and doctors for an annual preventative checkup, right? Like we go to the dentist for a checkup. So it's the same thing. You should see a counselor for a checkup as well. The second myth that I was talking about was that why should I see a counselor? It's the same as talking to my friends. So myth is that talking to counselors is the same as talking to friends, and no, it's not. So let's get that out of the way. Counselors are trained professionals, okay, who have had a lot of training, lot of education and practical experience as well, dealing with people who have similar problems as yours. And not only that, but counselors also use scientific methods and research-based techniques. And the skills and tools that you learn in the session are something that has been highly researched, and it's evidence-based practice. So it's not something that you would just get like an advice from a friend based on emotions or based on opinion. It's not opinion, it's based on actual research. So that's number one difference between a counselor and a friend. The other major difference is that when you talk to a friend, you may face some judgment, or you have to be a bit more careful about, their feelings, because there's both persons' feelings involved in a normal conversation with friends or family. You have to be a bit more respectful. You have to think a little how it's going to affect them. But, the best part about counseling is that the counselor is there just to listen to you and just to work with you. It's not it's not about them, it's about you. That's the session, right? It's about you. So you can completely use that hour or 40 minutes that you get with the counselor to just talk about your thoughts and feelings without worrying about how it will impact your relationship, the therapeutic relationship that you have with the counselor. Because the non-judgmental way of counseling is something that's really what works mainly, is that the counselor is non-judgmental and works in an empathetic manner with you. So it's about you. And also when you're talking to a friend, you don't know who they will go and tell your secrets to. So you're always on the more careful side, and you don't really speak your heart out to that level. Whereas when you're talking to a counselor, the best part is that counseling is completely confidential. So whatever you say remains between the counselor and you, the client, right? And it does not get out of the session. Once it's there, and it's done in that 40 minutes itself. So, and I'm sure you take something out of that session and you take it with you, but that's the end of it. There's no more talk anywhere. Your family won't find out about what you've spoken, and that's a major concern that people have, whether somebody that you're talking about is going to find out what you're saying. And no, the counselor is going to be bound by confidentiality and not reveal what you are talking about. So the third myth that is really prevalent about counseling is that it's extremely expensive and time consuming. Like, I don't have money to spend hours of counseling. So I understand that's a very logical thing. So it's a tricky one, right? While psychotherapy for mental disorders is long term, it does require a lot of patience and a lot of time. Most counseling is not time consuming at all. It's literally just 1 hour or 40 minutes per week, like with Fitzoh. So you don't have to spend hours and hours. In fact, with Fitzoh, you can even get it be a part of the package that you take, overall. So you're taking a physical package, and counseling is sort of part of it. And it's not even, that's the best part, it doesn't even make it expensive. It's something that just comes in your package, and it's once a week. And the thing is, if your issue is like very minor and you just want to work on your self-development goals, or just you can even see a counselor on an as and when basis, or once every 2 weeks. It doesn't have to be something that you do daily. Yes, you can obviously do more if you want to, but it's not a requirement, and it is not something that has to be done. So lastly, the thing that I want to the thing that I want to address the most is that the biggest misconception is that counselors are there to give you advice, and they will give you solutions to your problems. And people don't always want solutions, first of all. Some people just want to talk, and that is exactly what counseling is. It's not about giving solutions, it's not about giving advice. It's to listen to you talk and to work together to come up with a solution. Now, how do counselors do that? What happens is that when you are talking to a counselor, the counselor is talking to you in a non-judgmental way and also mirroring you, right? So the skill that we use is being like a soundboard or a mirror to you, and reflect your own thoughts and your own feelings back to you, so that you can better hear yourself, and you get like an outlet. In that 40 minutes, it's yours to just talk and come up with your own solutions. So the counselor facilitates the conversation. Sure, they will guide you into the direction to give you the right solutions, but that does not mean that they will give you the solution and advice directly, like here's what you need to do. No, it will be structured, it will be guided, but not directly solution oriented. Yes, sometimes psychoeducation is involved in the sessions. So you may be going through an event in life where you don't know what's going on, and your counselor will clarify how things work and the psychological aspect of it. There will be psychoeducation, and there is also the tools and techniques that you use and learn in the session itself. So yes, those will be taught to you, and they will be also practiced within the session and later on, and there will be a discussion of all that, but not direct advice. Okay, so I do hope that that was clear, and it does clear some of the myths that you may have had so far. I'd be happy to answer any questions so far if you have any doubts, so please let me know in the comments. And are there any comments so far? So anyway, if you have any questions, I'd be happy to answer them. We have 5 minutes to do that. But in the meantime, I could, I'd like to tell you a bit more about the counseling at Fitzoh specifically. So as I've already said that, counseling can be for small issues or big issues, regardless of whether you have a mental illness or not. So you can see for relationship problems or, anxiety, depression, small ups and downs, or even self-improvement, development, whatever you want to recognize and work on. So each counseling session that you have at Fitzoh, we will be working on these parts. And in the first session, we will decide what you want to work on specifically, and then every week we will monitor those goals. So if your goals are related to your physical health, you will also be seeing nutritionists and physical trainers, yoga trainers. You'll be having these sessions also weekly, right? So we can discuss these things that are going on in your life, and also if there are any issues at home, any factors that are affecting your ability to do the workouts, or any factors that are affecting your nutrition, maybe you're not getting enough sleep, maybe we could talk about that. So these are things that are helpful. In fact, Fitzoh has now come out with an offer where you get 1 week free access to all live sessions, like all live consultation with nutritionists, and live group yoga sessions, and then there is live group strength training. So your nutritionist will give you a customized diet plan, and all the group sessions for workout, they're completely free for for 1 week, and you can have these unlimited fun workouts with your trainer's guidance through video call as well. So I think now is the right time for you to give it a try, and I hope you would give counseling a try as well after this session. So, thank you. I'm glad that we got to have this talk.